Dr. Tang, would you comment on how it might impact your work as a psychiatrist if it was mandatory that you refer a patient of yours who requests medical assistance in dying to a willing practitioner?
So in my work as a psychiatrist, I deal every day with patients who have either tried to commit suicide or are chronically suicidal, very depressed, suffering immensely. And it is my job as a psychiatrist that they are able to come to me in a place that is safe, like the hospital, and I give them hope in a moment when they have lost all hope. And they need to see that I remain consistent in this. It is very difficult for me as a professional physician and psychiatrist to say that some of my patients, maybe I should be referring them to medical aid in dying. When do I make that decision when this would be suitable for this patient or not for others? With the whole issue of conscientious objection, it's almost as though my professional judgment has been stripped, because they say, well, if you are a conscientious objector, which I am, I must make a referral, no matter what I think, whether I think this might be good for my patient or not. Whereas those who do not necessarily have conscientious objections don't necessarily need to make this effective referral. And so it places me in a very difficult position, because I know that if I am to make an effective referral, I will most likely be making it to my colleagues who do not have conscientious objections to this in principle. And how do I feel about sending my patient, somebody I know that I could work with if they would be willing to work with me, to somebody that I know may be also the person that would be causing the death of this patient? I wish to be able to do my work, which I honestly love. It is the most rewarding thing to be able to work with my patients and journey with them and to see them come out of a very dark place. I need time to be able to do that with my patients. And if we do not have legislation that allows me to practice according to my conscience, this time that I have with my patients to work with them will be truncated. And I feel for their detriment and to the detriment of the families and the friends of the patient that are left behind, and also to the individual healthcare professionals and the team members who work with this patient as well.